Hello and welcome to Lakeside Holistic Health. This is Dr. Jerry Bailey. On behalf of Dr. Pamela Langendorfer and myself, I'd like to say welcome to our practice. This video is going to introduce us to you and our philosophy and practice goals with you for Lakeside. We are here to help guide you through your illness to a state of wellness. And that is our goal of the clinic here, of our practices, is to really help you get to that point away from illness, into your comfort zone for maintaining your health, and then eventually building up to that optimal health through a wellness plan. You'll see this poster hanging around the office. You'll probably get it in your new patient packet also. And really, every life decision you make directs you towards or away from the wellness in your life. So which way are you headed? Most people present us with either poor health or a disease in and of itself there. So they're on that left-hand side of the screen there towards that developing disease or illness. And we work with you through your diet and different things to get you to more of that comfort zone of maintaining health, get you without symptoms, get you feeling better, kind of really starting to do some exercise and things in your life. And then we want to work you towards, once we get there, graduate you on to more of a good health and developing a wellness plan for you. So that way you have a successful life. You are living the way you want to live. You're eating really good foods. You're being healthy, you're being active, you're not in any pain, any swelling, all those things that you may be presenting with, you're feeling really well. So like I was stating, as we move from that illness to the comfort zone, we want to make sure we build on your life to become into that wellness phase there. Things to remember when we're working with you. It may take some time. Initially, depending on what's going on, it could be a couple months before we get an improvement, but we should see steady improvement during that time. Eventually, it may be where it takes 6 to 9 months up to a year. Some cases we have seen us taking to a year and a half to really get better. For the most part, we should see pretty rapid improvement pretty quickly, and then maintaining that and getting any healthier and healthier as we go along. Everyone has setbacks and bad days. That's normal. That's part of the healing process. You're always just one phone call or one step away from talking to us to getting back on track and getting yourself back to that wellness goal, back to that optimal health, building those stages as we go. Missed appointments will set you back. You want to make sure you keep your appointments. If you have to cancel, make sure you get in as soon as possible. The staff at the front desk will make sure we get you back on the schedule so we can keep you going, building that health and building that wellness in your life. If you keep missing appointments, it just keeps having setbacks, and we want to not have those. We want to build to the future. Doing these things really help plant the seeds of success. And that's what we want to do with you, is plant those seeds, get you moving forward in a healthy progression there, not have very few setbacks, and then making sure you're keeping your appointments there. For a period of time, we want you to make this your hobby. This needs to be your hobby. This needs to be the thing you're focusing on each day and getting yourself better and better, and not just seeing us and then forgetting about it. It needs to be a hobby in your life. You need to create that hobby. In order to replace a bad performing hobby that you have to have a good one. And it takes about 3 weeks for that to set in. So those first 3 weeks are going to be pretty intensive, but we're going to work you through the process and help you get there to start the goals, to make sure you're successful. You also need to decide to love the process of getting well and thriving. That's key. If you don't like the process, it's going to be harder and harder to get you better. We need to help you get through that process to get well and get thriving, and then really, making sure you're loving it, and that's going to create that health in your life. So at Lakeside, we take a different approach, kind of a triad approach here, just like the triangle. We use your timeline of your life, what's been going on, which is called your timeline history there. We will use appropriate advanced functional lab testing. These are beyond your basic lab testings that your primary care or your specialist may do. We look at those labs, but then we look at more functional labs, shrink those ranges down for those labs to make sure you're in an optimal area to get yourself going and being healthy there. And then we really help you to develop a life plan. And a life plan is really what we're going to set out for you for the time period we're going to be working together, to plan ahead and make sure we're hitting all those processes to get you healthy. Number one is diet. Diet is always number one in what's going on to make sure we're getting you healthy and doing there. You can do all the changes you can with what we do as far as acupuncture, chiropractic, herbal medicine, supplements, those things. But if you're not correcting the diet, it's just what medicine is doing. It's just putting a Band-Aid approach there. We have to correct diet, which is always number one. We also do acupuncture. Dr. Pamela and I both do acupuncture here. That may be part of your treatment plan to get you healthy through the process. We may include chiropractic. If I'm seeing you, I may be having to do some chiropractic adjusting on you, whether it's spinal related or shoulder or arm, wrist or elbow or knee or toes, ankle, hip. I work on the whole body through there. And part of Dr. Pamela's plan may be, we need to get some adjusting in there too. So you may be seeing me, Dr. Bailey, as part of that plan. We also may include supplements there, and those are really key. We use really high quality vitamin, mineral, herbal, and nutraceutical supplements. Those supplements we research. We are constantly, each week, each month, going to seminars on weekends to make sure we're getting the highest quality stuff, the up-to-date research-backed evidence to make sure we're using the appropriate supplements for your case, for what's going on through there. And we make sure the companies we use test their supplements. You see it on the news, you see it there. A lot of the store-bought varieties, they're okay, but they tend to be low quality. We want to make sure we're using products that are high quality. What is in there? They use a third party to test it to make sure what's in there is in there. And that's the products we use. Dollar for dollar, it's actually you're spending less by buying products from us than you typically buy from a grocery store or from a supplement store. Your treatment plan may include exercise, and that's a key thing to remember that, once we get you healthy, you got to start moving. Movement is essential to life. If without movement, we degrade down. Exercise doesn't create degeneration, but sitting there in front of the TV, at a computer station, sitting a lot of times causes that degeneration in the spine and in the body, causes problems throughout the body. Exercise is key. And sometimes with Dr. Pamela, we may be having to do a pharmaceutical prescription if it's an antibiotic or something else in that process, or if it's a hormone replacement therapy that she's doing, we may have to add that in there, and that's just part of the process. Eventually we want to get you off those and onto either supplements or you have your diet correcting the plan. But, sometimes it is necessary, and we're okay with that as a practice to use those prescriptions for those circumstances. Again, as we're working through there, you're looking at that timeline. What is going on with you? That's key to finding out when things started, what happened before that, to really figure out how we can correct your health. We're going to use functional labs. We'll go over that a little bit later in here. And then we're going to formulate that life plan to really plan out what you need to do from what all the services we offer here, whether it's diet, acupuncture, chiropractic, supplementation, exercises, or prescription items, what you need from there. Now, this is the functional medicine tree. We tend to follow this here. As you can see, we don't use it a lot to explain things, but we may if circumstances arise for you. But this really formulates everything we do in the clinic. We look at your personal lifestyle and environmental factors in your life. We look at mental and emotional and spiritual influences that can have an issue on your life, genetic predispositions. We do some genetic testings, and then other things that can be going on there. We look at those that are called antecedents, triggers, and mediators, which are all those things that develop and cause your health issues there. From there, we look at an organizational thing, if it's assimilation, if it's detoxification, if it's energy production, if it's just all those wonderful little things there, integration there, what's going on with your body, and then correcting it from there for those imbalances, and then looking onwards and upwards as those signs and symptoms that are developing from there, and then organ systems or individual organs that have issues. This is how we look at you when you come in. Really looking at you as this tree and what's going on. Is there a really underlying root problem? Is there a dysfunction problem? We look at this and look at you and decide what we need to do based on what we're seeing in your history in the labs. We use this little timeline here to really see what's going on there from your birth, prenatally, that could be occurring that caused some issues, on up to the current concerns there, any signs and symptoms or diseases that you have, triggering things that can be causing those things, like you had an auto accident per se, and then since that time you've had issues with back pain. And then anything that's going on, preconception as far as parents, they drank or smoke, or they didn't take any prenatal vitamins, they didn't take care of themselves, so that could lead up to issues in your health and life there too. So we use this as a little timeline exercise to figure out things that are going on with the person. Functional labs itself, these are labs that we run regularly on people, and these are the ones we recommend. A lot of physicians may just order a base screening exam, lab work, like your thyroid, your CBC, your chem, those type things. But that's just the tip of an iceberg. If something's off there, they try to make a clinical decision, but we don't know what's going on further down the chain. So we run labs and more advanced labs to make sure we're seeing what your body is doing, not just the tip of the iceberg of this little process of, say, high cholesterol, but what is your cholesterol doing? What's it breaking down to? Is it really dense, or is it really puffy LDLs? So, that's what we want, really puffy LDLs. What's your HDLs look like? What's the breakdown of those? Are there inflammatory markers that are associated with it that can and look at better, more specifically, looking at cardiovascular risks through there. So different labs that we run are looking at that broader based, what's going on with you, what's the functional state of your body, not the disease state of your body. So we'll run a functional thyroid test. We may run ferritin, looking for inflammation. We'll run vitamin D particular. We'll look at insulin and then the hemoglobin A1C, which is looking at your glucose levels, kind of looking at how well you're regulating glucose, how well your insulin's responding to glucose levels there. We'll look at that functional cholesterol like I was talking about. We may look at an inflammatory panel to see if there's a lot of inflammation occurring in the body, and then we know we need to address that, or where is it coming from is the key. All these labs that we run are looking at what is going on, where is the problem coming from, and correcting that underlying dysfunctional state before it becomes a pathological issue. We may run an organic acid test, and that looks at really how your mitochondria are functioning, how well your body's detoxifying itself, if there's a bacterial overgrowth in the small intestine or large intestine through there. So we look at lots of different things, and it looks at cellular inflammation also versus global inflammation on a regular lab work there. And then we may run a diurnal cortisol test to look at what your cortisol levels are, and then also what is your cortisol breaking down to, and the ratios of the cortisol to that breakdown of cortisone, so we can see how much your body's going through, how much of a stressful state in there. And from these tests, we can also look at some genetic testing to really see, is there an issue that's your genes that are causing this, and then correcting it itself with some simple supplementation through there. That's what's wonderful now about the genetic testing and all this testing that we do, is we can finally put them together into a cohesive picture and figure out what's going on and then correct it. Before, with the genetic testing, we had really very little data to show what it actually means, but now with this more advanced functional testing, we can combine those two into a single picture and really see what's going on and then correct the underlying dysfunction that's occurring, whether it's a genetic cause, or if that genetic change is there, those little genes that are turned on or off, we can do some nutritional things to help them function better through there. And then we also will look at hormone metabolites, and that's really key into balancing the body overall, is looking at how well your hormones are performing, what they're breaking down to, and then the risk factors associated with that if there's an issue. So these are the typical labs that we'll run. It's usually really kind of 4 or 5 tests all combined right there versus everything you're seeing. So a blood draw, we can run some urine examination for the organics test and the hormone metabolites, and then the genetic testing that we can do also through there. From these, we really look at what we need to do from the history and functional labs. Then we go into your life plan itself, is what do we need to do? Well, number one is always diet, and that's the biggest thing we try to correct in people, because if we can't fix diet, it becomes harder and harder to really help you get healthy and get to that optimal level of wellness there. So we typically will use a Paleolithic or a low carbohydrate type diet to really help get your body eating whole foods, eating those natural foods in their natural state, to nourish your body. We want to make sure they're nutrient dense and calorie poor. So you're feeding your body. Your body runs on nutrients and calories, not just calories. And so we want to make sure we're getting a nutrient dense diet along with the appropriate amount of calories. We may include acupuncture in there, and like I said, Dr. Pamela and myself both do acupuncture, so we may include that as part of your life plan there. Chiropractic from myself, Dr. Pamela will refer over to me for chiropractic work for you. We may include some supplements within there depending on what's going on. If we're working on hormones, some kind of hormone replacement therapy, and then definitely exercise, as we talked about there before, that is key. It may be a while before we get to that point to add exercise in, depending on your case and what specifically is going on. And then finally, it may require a prescription to get you better. And that's Dr. Pamela does that. I do not. But we may work with your primary care at that point to get a prescription in your system to help with what's going on till we can get you balanced with those other things. Medications are really designed to be a short-term fix for a long-term problem, but we need to correct the underlying issues that are causing those long-term problems and not rely on the medications, because then we have just build up and build up and build up of multiple medications, and then you just have issues that develop from that. So acupuncture itself, that's one of the tools that we use here, both Dr. Pamela and myself, Dr. Bailey. Acupuncture is about 4,000 years old. It's been around a long time. It works on a lot of different things. We work on depression and anxiety, on up to skin issues, eczema, psoriasis, to arthritis, to headaches, migraines, to vertigo, to joint pain, to cholesterol issues. We help with monitoring depression. So there's lots of things that acupuncture works for. You just think of it as a subset of medicine that's just another way of looking at the body. And that's what's unique about Dr. Pamela and myself's practice here at Lakeside is we have these multiple tools that if you're not quite fitting in a paradigm of Western medicine, a diagnosis there, which a lot of patients don't, we can bring in that Eastern medicine, the acupuncture, and see the imbalance that's occurring in your body from a nature perspective and then correct that underlying balance from there. So it's a uniqueness that we have both worlds that we can work with you on. They're very small, fine needles, as you can see in the picture right there. There'll be lots of different points throughout the body that we may use. Some may times be on the scalp, on the back, on the arms, on the legs, on the abdomen, depending on what's going on. But it's non-painful. Most of the time you don't feel anything at all or a slight little poke through there. And we're one of the few doctors that can say, you know, everything we do to you, we've had done to us, so we know what the acupuncture feels like. We may have to use moxa on there, which is mugwort. It's a herb, and that just heats up certain points in the body. If a person just cannot handle the needles, we may use the moxa on there. We also do cupping, and what that does is using glass jars that will create a suction against the skin, help to pull out inflammation. It's a wonderful little tool that helps to balance the body and creating, moving inflammation out of an area that may be causing stagnation in the area. We also, you notice that, you know, it's very relaxing. Most patients come in and say, I don't relax, and we do acupuncture, and they are really relaxed by the time they're done. It's usually about a half hour to 40 minutes if we're doing acupuncture and cupping there, but plan at least a half hour for the acupuncture to get benefit and to have an effect there. So it's a half hour relaxation time and downtime. We always recommend just to relax afterward, take your time getting up off the table, have some tea, have some water, just kind of rest. It's kind of a forced relaxation, which we like to see, and allows you to really just get from that sympathetic, that fight or flight mode in your life to that parasympathetic, that relaxation, that calming state through there. So sometimes people get up and they feel a little dizzy, so we always say, just take your time getting up. And these treatments are based on functional medicine principles. It's just what is the underlying cause? Let's get it corrected. And then it restores balance. That's the key, is balancing your body naturally with just placing some needles throughout the body. Chiropractic, this pertains specifically to me, Dr. Bailey. It's the innate health potential of our body. Getting the spine adjusted, getting the nervous system really functioning the way it's supposed to is going to control everything. The nervous system controls everything in the body. If we don't get interference from that nervous system corrected, you're going to have issues. So again, like I said, that nervous system controls all functions of the body. Irritation of those nerves lowers the function. It can lower immunity. It can lower GI function, gastrointestinal function. It can cause back pain. It can cause, I've seen it cause rib pain that actually mimics a heart attack in patients. I always recommend, if you're having chest pain, to get the EKG done before we see you to make sure it isn't heart. And a lot of times it can be rib. Headaches, elbow pain, wrist pain, knee pain, all those things works from a chiropractic perspective, that we can adjust the joint and get it moving and functioning optimally there. Adjusting, we remove the irritation by adjustment itself. And I say again, not just the spine. All ages are welcome in our clinic. And I've worked on brand newborns, my children in particular, within a few minutes old, to elderly population, 90-plus-year-old. I think my oldest patient's 96 right now. And so we work on all ages. It's gentle, it's hands-on, but we get you feeling better. Supplements itself, we use a wide range of supplements, sometimes capsules, sometimes compressed pills, sometimes teas or liquid through there. We always make sure we're using high quality things, high quality supplements in there, that you're getting the best for your, best bang for your buck. We're using products that you're going to absorb the most of, and you're getting the best quality that are out there. We spend a lot of time researching and making sure we're using products that are beneficial not only for you, the patient, but for us, the practitioners, that we use, so we can get the results we need to. All the companies we use, they use third-party testing to make sure they're using the products that are in there that they're saying, and that they're guaranteed within those products there. Again, here's that little triad there. We use that unique approach here, that we use that timeline history on you to figure out what's going on. We use the functional labs, and then from those, we decide what your life plan is. If it includes acupuncture, or diet, I should say, acupuncture, chiropractic, supplementation, exercise, and then finally, if we need to, a prescription item through there. So this is what we utilize every day. We figure out what's going on, we decide what labs to run if we need to run labs, and then we decide the plan you need to get you from that illness state to that maintaining health state to that optimal health state, that wellness state there. by utilizing, these principles here in functional medicine from all those triggers, antecedents, and mediators there below, things going on in your life, to figure out what they're causing as a symptomology and an organ problem, and then correcting that underlying imbalance. So once again, every life decision you make directs you towards or away from wellness. Which way are you headed? As you come in to see us, as we stated earlier, you usually are in that developing disease or disease state, the illness or poor health, and we're going to want to get you to that maintaining health portion, that comfort zone, and then work you into a wellness plan to get you really optimally functioning and have that optimal health, the good health you want. On behalf of Dr. Pamela and myself, Dr. Jerry Bailey, and Lakeside Holistic Health, I want to say thank you for becoming a patient with us, and we look forward to working with you to get you to the optimal health.